Thanks for joining us today. Town Hall Project is a nonprofit organization dedicated to the simple principle that our democracy is stronger when lawmakers take the time to listen to their constituents. We are in a unique moment in our history, and Town Hall Project by no means are policy experts, but we know about town halls, and we are pretty confident from what we've heard from hundreds and hundreds of Americans that if Congress was able to hold in-person traditional town halls right now, they would be hearing an overwhelming number of stories from Americans in crisis or on the brink of crisis at this moment. So it's unfortunate that due to health reasons, members of Congress should not be holding in-person town halls, but they should be holding virtual town halls. And too many, unfortunately, are not. A prominent exception, as always, is Senator Ron Wyden from the state of Oregon, who's joining us today. And he has been good enough to listen to not just Oregonians who are experiencing unemployment, but folks from around the country as well. So we are heartened to have this conversation, to hear from people who are unemployed or experiencing the impact of unemployment in their family and community. But before we get going into town hall, our other panelist is Michele Evermore. She is a senior researcher and policy analyst with the National Employment Law Project. And she is one of the foremost experts in unemployment policy in the country. And would love to hear from her on really, what the state of the situation is in terms of upcoming deadlines for Congress to act. Michele?
Thank you. Thank you for having me. And I'll be really brief. I'm excited to get to your stories and questions. So just a little definitional stuff up top. We're going to be using probably some acronyms. PUA is Pandemic Unemployment Assistance. And that is the system that was set up to be parallel to unemployment insurance. And so it allows for people who are self-employed, independent contractors, misclassified as independent contractors, or who qualify because they have a COVID-related reason, but otherwise wouldn't qualify for unemployment insurance to get a benefit. The other one that will probably come up, although I generally refer to it as the $600, is FPUC, FPUC, and that's the Federal Pandemic Unemployment Compensation. So there are two different things here going on. Pandemic Unemployment Assistance, or PUA, the side benefit that looks like UI, doesn't expire until January. But 3 days from now, the computer systems that pay out the $600 will be switched off. Next week, people will get their last check. And those systems won't be turned back on again until weeks after Congress finally does act. Now, way back on May 7th, Senator Wyden introduced a sensible proposal to extend the FPUC, or the $600, so long as economic conditions require it, and then wind it down as conditions improve, along with provisions to automatically extend benefits as long as they're needed. The House passed the HEROES Act to extend the $600 back in May. This is a disgrace, an utterly avoidable failure. Proposal seems to be floating around out there to replace the $600 with 70% of income. And perhaps Senator Wyden can shed more light on what's going on with that, because it's not very clear. But if it's a percentage of income replacement, here's the problem with that. So they're saying 2/3 of people getting a benefit right now are earning more than they were when they were working. So let me explain how that works. The $600 is the difference between average benefits and average earnings. So in theory, if this were an average recession, half of workers would get more and half of workers would get less. But it is not an average recession. COVID layoffs hit lower income workers the hardest. And thanks to PUA, people who earn some money but not enough to qualify for UI are now getting a benefit. So people who earn the least tend to spend the most in the local economy. And I would point out that 46% of workers currently getting a benefit are workers of color. Cutting off benefits disproportionately harms Black, Latinx, and Indigenous people. Both the state and federal UI system tends to be worse in states with the highest populations of workers of color, both in terms of who gets benefits and how much income replaces. And that's why these two programs, hand in hand, have papered over all of those problems and have saved lives, frankly. So I don't know what the plan is entirely with this percentage replacement, but it seems like just an attack on low-income workers and workers of color. But I trust Senator Wyden to bring his good sense to this conversation, and look forward to hearing from him.
Senator?
Nathan, would you like me to hold forth here?
Yeah, if you have any introductory remarks on just what's going on, would love to hear from you.
Yeah, I'll be very brief, not only because I spent the last hour on the floor talking at a high decibel level about how immoral what the Republicans in the Senate are doing, but we really want to hear from you. I do want to make sure you know that with Nathan at Town Hall Project, you got the gold standard in terms of civic participation. We've had 7 virtual town halls with my constituents in Oregon. Thank you very much, Nathan. This is our 2nd national town hall. The first one was on vote by mail. I am, along with Senator Klobuchar, the sponsor of vote by mail legislation to give everybody a chance to vote the way we do. I'm the nation's first mail-in United States senator. And I'm just thrilled that Nathan would be able to set this one up on unemployment. And to have Michele here, she is basically the superstar of this whole field. And the other thing I'm very happy about after a 14-hour day is when I get a really difficult question, I can buck it to Michele. And that's a special little perk. Let me give you a quick sense of how we got into this. And when we knew workers were looking at the worst situation, and we thought then, and it looks now, since the Great Depression, we were not going to accept these Republican arguments that workers should just go pound sand. And ever since then, it's been a battle. I'll talk a little bit about what went into the first package, but what I said on the floor is the House acted, Senator Schumer and I have put together a package that ties the benefits, the economic conditions on the ground. Unemployment's so high, people would get $600 extra per week. But the Republicans have basically told, workers not interested, not interested. And what I said on the floor maybe 20 minutes ago or something like that is they've got plenty of time to introduce legislation to help multinational corporations, people with a lot of power, political action committees and the like, but knowing that folks within, and I think Michele, I always say 2-3 days because Michele is the expert on when all this actually kicks in. They basically said that it didn't matter to them when people all over this country were hurting in 2 or 3 days, when they couldn't make rent, couldn't pay groceries. They'd leave town, even after they've been proposing all those bills to help the multinational corporations, because they just don't see the faces I'm looking at. The faces of people walking on economic tightrope, balancing their food bill against the fuel bill and fuel against rent. And so the pain people are going to have in the next few days didn't have to happen. We've introduced legislation. We wanted to negotiate. People have differences of opinion. I've been reaching out to these Republicans. I said, I heard you. You want benefits to taper off if economic conditions get better. And people, not so many people are out of work. That's what our bill does. But when people are hurting and can't pay rent, can't buy groceries, and I'm already hearing families, parents telling kids to eat a little bit less. This is America, not our set of priorities. Last point is, and thank goodness we have Michele here. We have heard the most horrendous accounts of people getting caught up in red tape and bureaucracy. And we knew that a lot of these states had technologies that were out of yesteryear. At one point, I pointed out with Secretary Mnuchin that the computers were 60 years old. I said, I'm voting for technologies that are almost as old as I am. So we know a lot of people are still suffering, particularly in the area Michele mentioned, the gig worker, the part-timer, the freelancer. I insisted that they be part of the package because unemployment hadn't changed much since the 1930s. I wanted them included. But we knew this was going to be a hard ride. But we didn't think it was going to be this hard. And that's the reason why we did that averaging, because we were told at least with the averaging, millions of people could get some help. So I really appreciate everybody taking time to educate me. Softball questions for me, please. Difficult ones for Michele. And just thank you for taking the time to educate me. And when you got Nathan, you got the gold standard for civic involvement. When you got Michele, you got basically the NBA All-Star champ. I'm a basketball player, so that's my reference point. Got the all-time champ on the subject. And let's just go and let you all, for the chunk of time we are blessed to have, let you all educate me, okay?
Great, thanks, Senator, and appreciate the shout out. We, like I said, we received hundreds of stories of people in crisis, or on the brink of crisis, and this is just a few of the many folks around the country. So first up is Donna Lynn from Wichita, Kansas. Donna Lynn, feel free to unmute yourself.
Where is Donna Lynn?
I'm at the very top.
Hey, Donna Lynn, before you start, I was born in Wesley Memorial Hospital in Wichita.
I was just going to ask you if my research was right. That is awesome. I want to thank you, Senator, and Michele, both for listening to us. So basically, my question is probably for either one of you, but I'm single and upper middle class, and without the 600, my income drops, and to where I'm not able to keep what I have or pay what I have from the lifestyle that I had prior to this crisis. I think my question is why is it not standard, the unemployment is not standard among all states on certain issues? And the one roadblock I have is I cannot supplement my unemployment. So I cannot go get a part-time job, or I cannot do freelance to bring my regular unemployment up to cover my cost of living, or I get penalized and I lose that. And that's in Kansas. And I think in my research it's not that way all over, but that is a huge roadblock for me. And I just want to know, why are we not standard across the country with some of these roadblocks?
Why don't we let Michele start, and then I'll pick up with that, because this is a combination of substance and legislative inclination. Michele, you want to start with that?
Yeah, so it all goes back to 1935, where the Social Security Act and the Federal Unemployment Tax Act set up a system that's federal with very minimal federal requirements, and the states have broad latitude about how much benefits can be, how they deliver those benefits. And so as a result, across states, there's a wide range of discrepancy, from anywhere from $213 in average benefits in Mississippi to $555 in average benefits in Massachusetts. So there's quite a wide difference in how much people get, and a huge difference in how many people get it. As few as 9% of unemployed workers in North Carolina are eligible for benefits, but that goes up to over 50% in places like New Jersey and New York. So access and benefit generosity vary quite a bit across states. It tends to be much worse in the South. Kansas doesn't have a particularly generous program. And I think that we need to establish a federal floor so everybody has equal access to benefits.
And I will tell you, I was just going to that question of a kind of floor of justice. What Senator Schumer and I are doing with our bill is beginning that kind of effort, because what we wanted to do was provide some certainty and predictability. We knew Mitch McConnell would always try to, instead of basing unemployment benefits on need, he would always try to take an arbitrary date, then run right up to the date and then make it hard for people to get benefits. So as we look to the future, we really would like to have a basic floor of justice. I know that that's, as I listen to so many of the stories, and I go home and sometimes my chin is just barely off the curb because the accounts are so sad about people falling between the cracks. That's cold comfort to you today, that you're not part of a national system that establishes the Michelle Ron basic floor of justice so that nobody falls between the cracks. For those of you who have questions, and Michelle, as I was listening, I was wondering about some of the other specifics. If people would like us to try to follow up on specific questions, if you can get those to Nathan, there may be opportunities in which we can kind of wring more assistance out for people. But I suspect that this, based on the account that Michelle and I both gave, because that was the nature of the system. And I think, Michelle, the only thing I would add is that to a great extent, employers back then really wanted that kind of connection because they thought it gave them kind of more leverage over workers. And I think now, particularly in a mobile society, we really need to look at a basic floor of justice for everybody in America. And I heard a rumor there was an election coming up in November, and maybe we can change things and get to work on that.
Great.
Thank you.
Thank you, Donalyn. Next up, we have Stephanie from Virginia. Stephanie Freed.
Hello, Senator Wyden.
Okay, Stephanie, you're on the phone. We can't see you, though.
Oh, no?
There you are. All right. Extended PUA.
I'm Stephanie from Virginia. I'm an unemployed freelancer in the entertainment industry. And along with my colleague, we created a resource called extendpua.org for the unemployed people to come to our website and find ways to reach out to their senators on this issue. My question is, I'm an unemployed member of the entertainment industry. As I said, 77% of the people in my industry are at 100% income loss. And our industry isn't expected to go back to work until well into 2021, with deep ramifications projected for several years. Is there any plan to address the live entertainment and other face-to-face industries like travel and hospitality in the coming relief legislation?
The answer is yes, and it's a big priority. And we know, for example, in my hometown, there's great interest in the hospitality sector. I think you said did you say you were a musician by training?
I'm a lighting tech.
Lighting tech, okay, yeah. And so the pandemic assistance took forever, as you know, to get up and running. And we've still got, as far as I can tell, thousands of workers in your situation still waiting to get their first check. And this has created astounding hardship for people who, in your field, lighting, tech, are used to being able to take care of paying their bills. Now, one aspect of this is that your benefits are retroactive. So I know it's phenomenally frustrating, and I even said it on the floor. Retroactivity doesn't allow you can't eat retroactivity this weekend. You can't use retroactivity to pay the rent bill that is due at the beginning of the month. But what we're trying to do is pressure the Department of Labor to help the states get the benefits out. Just this week, I introduced legislation that would provide additional funds for the technology. And we're going to try very hard to get extra help in coronavirus 4, which if Mitch McConnell ever decides to get serious about it, because he took 2 weeks off in July when he could have been working on this, we're going to try and work on hospitality. We're going to try and work on entertainment. And particularly, we know that a lot of people who are in your field and related kinds of fields are really falling between the cracks. And I think the other thing about what you're dealing with, it really exposes the big inequity. And some people might just call it a lie, but I'll be diplomatic as we start the meeting. When all these conservative Republicans say people like yourself don't want to work, you just want benefits. I've been telling them all the time, that's insulting to workers. It insults the dignity of work. It insults the workers who have a strong, work ethic. You're in your field, you don't have opportunities right now because guess what? It's the policy of the government to tell people to stay home, and also made it harder for people to go to venues and be part of the kinds of programs that you provide great assistance for. So we're going to be all over expanded help for hospitality, the kinds of things you're talking about, extra funds in coronavirus 4. And I hope Mitch McConnell is going to get serious about it next week. He's just taken weeks to dawdle and dither when we should have been working on this.
Thank you.
Thank you, Stephanie. Next up, we have Tripti from Washington, D.C.
Good afternoon, Senator Wyden. Thanks for taking my question. So I am living in the nation's capital. I am a laid off restaurant worker. Unfortunately, unlike your state, my state is not a one fair wage employer. And that actually impacted our ability to be able to justify some of our earnings when we were applying for unemployment. And what was probably really, really rough during this pandemic was that Washington, D.C. is not considered a state.
Right.
And Senator, I am going to ask you to please co-sponsor Senate Bill 1278, which requests that D.C. become adopted as the 51st state.
I am a co-sponsor.
Okay, you've signed on? Okay, it has not updated you.
Somebody told me that the other day, and we all went hair on fire, because I've been a co-sponsor now for some time, and maybe Michelle's got some added information that can be of some help to you, but I think Americans living in DC deserve full and equitable funding in any COVID package, and I am a co-sponsor of DC statehood. And after somebody told me that they couldn't see my name, I believe, and our legislative director, Sarah Biddleman, is here, then we checked and I am on. Yep. Okay.
All right, my apologies then, Senator. They have updated the record. I made sure to Google several sources and it didn't say that you were.
We'll do it again, but I've told them 3 times I'm on.
So because DC is not classified as a state, we received less funding.
Right.
Most states got 1.2 billion for their relief, and DC only got 725 million. And because of the amount we were given, there's been a lot less money provided to people who are very vulnerable in our community here in DC. As a matter of fact, I had to sit outside of Chairman Phil Mendelson's house and protect the crumbs of $9 million that were going to be given to excluded workers. And these excluded workers are people who work in the shadow economy, which are classified as gig workers or cash workers. And so when I hear Senator McConnell and other Republican members on the Senate saying that there are people in this country that are doing fine, the pandemic is lessening, it's not getting any worse, it's actually getting better, they don't witness or they're not close to the pain that I'm seeing every day. I, had to look constituents in the face as we were going before the chairman of the council and saying, you know what, this money provides the ability for us to stay in our homes. And it has been so incredibly frustrating to feel like our government does not care about members of our population the same way that the rest of us who are involved in mutual aid do. Like, we have done so much to help people that have been carved out of this economy. And I am just hoping that, you will be a voice of reason to not only make sure that the 600 is continued and extended, but to defeat this narrative that says that people who are having this extra 600 are living well beyond their means. I live in the nation's capital. My housing costs $1,500 a month. And I don't know anywhere in this country where people have affordable housing anymore. And for somebody like Senator McConnell to say, well, people are making so much more money than, they were before, I want to respond and say, you guys are exploiting the poor. Obviously, no one wants to be sitting at home right now. We would all love to be working, contributing to the economy, contributing to the betterment of our nation.
So the bill that you are talking about, because we have just consulted with all our little cheat sheets, is S631, DC admission state. We have 42 co-sponsors, of which I have been one since November 7th of 2019. So you are absolutely right. Michele, are there any other things with respect to the unemployment insurance situation that applies to the DC area? So that I also wanted to make sure, because I don't know if some trust people are following. Thank you so much for saying everybody wants to be working, because I am looking at the nodding of the heads. I just came from listening to how people didn't want to work and all this, and I find it just plain on insulting to the worker. And I heard as you were talking that it was your view that everybody wants to work. And I mean, just think about it. And I may have stolen this from you, Michele. If you're an unemployed worker and you have the choice to be in the private economy and build a future with upward mobility and higher wages and the like, don't you think those people are going to take that rather than something temporary like unemployment? The answer is obvious. Of course, they're going to take something that gives them more money and more future and more positive opportunities. So good for you. Michele, anything else on the DC scene that we ought to know?
Yeah, just building onto your point that people want to take work and they are taking work. Ernie Tedeschi at Everscore ISI looked at it and found that 70% of the people who went back to work were people who were earning more on unemployment insurance, but they wanted their jobs back because, things like employer-sponsored health coverage are important in a pandemic. But as far as DC goes, so there are actually 53 different state systems, including DC, Puerto Rico, and the Virgin Islands. And they're all state systems similar to other states. One thing I'd say about DC is it's actually a little bit harder to get benefits than a lot of states. Recipiency is below average in DC, and I feel like it's a state that should have high recipiency because people generally tend to get better benefits in bluer states, and DC is very blue. The other thing is the average benefit in DC is only $358 a week. And that's a little bit higher than average, but you know how much higher it is, how much more expensive it is to live here. That only comes out to $1,200 a month. And I don't know where you can rent these days for $1,200 a month in DC. So we do need to work moving forward to improve DC's system. I would say also Councilmember Silverman has been really active on talking about improving unemployment insurance benefits. And so maybe someday here.
Great, thanks, Tripti. On the issue of folks wanting to work, I would just add, when we started this town hall, we didn't just invite unemployed Americans. We invited business owners who are having trouble hiring back people because they're getting too much money on unemployment. And we did not get one business owner who wanted to participate. So they may be out there, but none wanted to join us today. Up next, we have Grant from New York. Grant McDonald.
Hi there. I'm Grant McDonald. I'm from I'm from New York, and I'm also, like Stephanie, with extendpua.org. Thank you again for speaking to us yesterday at the Capitol, and again here today. It is insulting that anyone would spin a narrative that any of us don't want to go back to work. I love my job. I absolutely would love to go back to work right now, but I recognize, like Stephanie, I'm in the entertainment industry. It is unsafe to do so. But as an organization based in New York, my organization, extendpua.org, did a deep dive into your joint bill with Senator Schumer, the American Workforce Rescue Act, and we had some concerns about it. It sounds like this bill is still in play from what you've just said, and with the number of infections and deaths rising faster today than when the CARES Act was passed, what is the argument for a second round of stimulus that does not exceed and expand the terms of the original CARES Act? Won't people in face-to-face industries like Stephanie and myself be punished for having jobs that are in more direct contact than others and can't come back at the same rate?
Yeah. Grant, those are very valid kind of concerns. And let me give you a couple of takes from the seat of my pants. I think the big problem that people have not paid attention to is that Eugene Scalia has been derelict in not meeting his responsibilities to define a safe workplace in the COVID era. And I start with the proposition that I talk to my employers too. I think most of them want to do the right thing. They want to be told, hey, you got to do A, B, and C, be safe for workers. They say, great, that's what I want to know. And deep cleaning and mask, whatever it might be, most of them want to do the right thing. And you've heard me say that I think most workers overwhelmingly want to do the right thing too. They want to work if they're physically able to do it. And we have been pushing to get Eugene Scalia to get off the dime and to basically release the guidance with respect to the whole safety kind of issue. I gather you might be also considered, where'd Grant go? There he is. People always move in the screens. You'd basically technically be considered a freelancer, is that true?
That's correct. So
okay. One bit
covered under the PUA.
Yeah, that was the one thing apropos of freelancers that we were able to get out of Eugene Scalia. Look, I don't think anybody ought to be surprised. Eugene Scalia's first public statement, as far as I can tell, after we got the $600 and we began to show that unemployment was going to be different, he ran off to Fox Business News to say that his big concern was unemployed people were going to be dependent on government. His words, not mine. So it has been a battle. And you bet, if you can give us suggestions on the safety issue that speak to the safety question and how it would affect employees and the responsible employer, in effect, establish a floor of safety. I know a terrific lawyer. I think her first name is Michele. And we can talk to her. Where'd you go, Michele? You out there somewhere?
I'm up here still.
Okay, I know a terrific lawyer, and we'd welcome those ideas. And I think I can speak for Senator Schumer as your senior senator and the Democratic leader. He would be very, very sympathetic to our following up on that. So If you give us a phoner and an email, text, whatever it is, we'll follow up with you, and we'll also make sure that Senator Schumer knows of your interest, and I'm sure that they'll reach out to you too.
That's great. We'll do that. Thank you.
All right, great.
Great. Thanks, Grant. Next up, we have Victoria from Williamsburg, Virginia.
Hi, Senator. Thank you so much. Oh, it's
There's
echo.
Victoria.
Hi. I have two things, and I'm sorry if that's echoing. I don't know what that's from.
Maybe, Victoria, could you just mute yourself while you're asking your question? Because there seems to be some kind of feedback. Or sorry, not mute yourself. Turn your speakers off. Or your volume down.
It sounds like one of those Alfred Hitchcock shows.
Can I send it in the chat?
Yeah. Do you want to send it in the chat and I'll read it? I'm sorry about your technical challenges. So
we'll read it as soon as we get it, Victoria.
Great. So Victoria's going to send that along. So right now, that was the extent of our folks with specific questions. We have a number of other people that wanted to share their story and share their experience. In interest of time, we're not asking Michele and Senator Wyden that you necessarily have to respond extensively to all of them. If you want to, by all means. But we just thought it was really important that these folks are heard, ideally by their own senators, but really, really glad both of you could take the time to do that. And when I get Victoria's, Victoria has sent her question. So let's go with her first. Victoria says, I want to know how they plan for us to get a job ASAP, as my job no longer exists. So how is it that I don't want to go back to my job when it's no longer there? How is that a disincentive to work? Trust me, I want my job back. And Victoria, as I recall, you were also in the events industry as well, right? You were an events coordinator? Yes, yeah. So Victoria, like some of our other folks here, is in an industry that is simply shut down. There is no work for her to take.
Right. Victoria, in coronavirus 4, a top priority for Senate Democrats is to find ways for people to get opportunities for new jobs and a path forward. I gather are you from Wisconsin? Where are you from?
Williamsburg, Virginia.
Oh, Williamsburg, Virginia. Well, in my part of the world, wood products is hugely important. So we have a 21st Century Conservation Corps to give people an opportunity when they're out in the woods to help clean out those overstock stands that cause all the fires, and guides and all the people who work in the recreation business. Senator Van Hollen and I have a bill that I think Michele was very helpful with, which would give people a chance to get some of the training, get financial assistance as they get on their feet for the jobs of the future, because there's no question that a lot of jobs are just flat out disappearing. And people want to know, not just are they going to be able to get a job, but they want to know that it's going to pay a decent wage. There are other kinds of approaches that we think make some sense. In some fields, what's called work share is something that we think is attractive, where the employer and unemployment insurance, in effect, team up, and somebody can have a chance to get into a new field and see something, promising as well. So 21st Century Conservation Corps, I think, is going to be very appealing. Certainly in much of the country where there is some rural area, because a lot of this is tied to the recreation economy, wood products, and the like. Virginia certainly has a fair amount of that terrain. The Van Hollen bill that I mentioned provides for an opportunity for people to get some of the job training that we think is really important in a path to new jobs. And then work share and sort of, they're actually, and I heard Michele, it was described by one senator today, there's some sort of cousins of work share, where in effect you would provide some refundable tax credits for employers who either hire people, bring people back, and the like. So we're going to be spending a lot of time on that, and I'd like to let Michele comment on some of the bills on offer, Michele, with respect to helping people who lost a job and the job is not coming back.
Yeah, so I definitely think that work sharing is a tremendous opportunity if there are going to be fewer hours available for a long period of time. You know, also, I just agree 100% with Senator Wyden that we just need to double down on how we look at job training in the United States and how we look at getting workers attached to new workplaces. And so I really hope that as this goes forward, we establish meaningful training programs. You know, one thing about unemployment insurance is that it's intended to keep people attached to work. And so getting an unemployment insurance benefit hooks you up to a lot of training opportunities. So I'd also encourage you through the workforce system, you know, people with work search turned off, you know, a lot of people aren't really thinking about applying for training. But, you know, there are thousands of programs out there, and there might be one that you would qualify for that could help you figure out the next step in life. I would encourage you to reach out to employment services and see what they have available. There may be an existing solution for you.
And that is available under the federal statutes in every state. Isn't that right, Michele? Okay.
Yes.
Employment services.
So sorry.
Victoria, if you wanted to type it, I can add your follow-up. In the meantime, let's start sharing our stories. We don't have a ton of time left, and I don't want to rush anyone, but do just be cognizant of the fact that we have a number of folks with us. So first up, if you're there, is Rhett from Centerville, Utah.
Hi, and thanks, Senator Wyden. I'm an independent contractor, and so I am in a lurch between two different things. On one end, there's unemployment insurance, which I don't qualify for. And then on the other end, there's pandemic unemployment assistance, which I also don't qualify for. And the problem with pandemic unemployment assistance is that as an independent contractor, I don't have a general ledger or a check register. And so it's been a really tough go for me because I've been stuck in this middle ground between the two benefit options. And I've just been in a complete lurch. So there's my story.
I'm going to let Michele mostly talk about it. I thought you were going to describe, you're really up against it. We've got people who qualify for UI but want to claim pandemic, and you know, we just have so many people falling between the cracks because the system is so out of touch with the modern economy. Now, Michele, as we know, the bill does cover independent contractors because I insisted on that in the negotiations. And I think the gentleman said his problem of being able to get covered just generally was related to some kind of sign-up requirement, to check register something. Can you elaborate on that? Because when I've heard about independent contractors, I've heard mostly about people waiting, just waiting and waiting and waiting some more. But the gentleman seems to have leaped beyond that and just been told that for some reason he can't get into the sign-up process. Is there anything else that we could offer that might provide him a little ray of hope?
Yes, so follow up with me offline and see, and let me look at what the actual problem is. I'm glad to try and help you figure out how to access benefits.
Michele, what did he call it? He said
Okay.
a check register?
Yeah, what was it? Yeah.
I think, sir, we're having trouble. What is a check register in this context?
I just was saying that at least in Utah for PUA, you have to have a general ledger and a check register. And I don't know much about it because I don't have them, but that seemed to be what kept me. It was asking otherwise for tax information like 1099, W-2s, and things like that.
Right.
But
yeah, the Employment and Training Administration offered pretty broad, said that states have to take a pretty broad number of things to document what it is that, how you earned your money. And so, yeah, just I'll post my email in here again and follow up with me offline. I'll see what we can do to figure out what's going on with your issue in Utah.
But I think one of the things, Michele, is that 1099s and those kinds of things are pretty common. So this might be something that we can get straightened out.
Yeah, Rhett, I think Rhett is calling in on his phone, but we have his email and we'll connect you, Michele. Thanks for that offer. Next up, we have. You. Yeah, thank you for calling in. Next up, we have Gwen from Talent, Oregon.
Hi, Ron, Wyden, and Michele. So on March 11th, I performed my dream job like I have every year for 25 years as a stage manager at the Oregon Shakespeare Festival for a performance that had just opened 5 days earlier and was supposed to run past Halloween. And the next day we were told not to come back to work. And as you know, Governor Brown said no more mass gatherings of more than 250 people. And we thought we'd be laid off a few weeks, and then 30 days, and then 90. And then by mid-May, 85% of the 500 employees down in Ashland were laid off without a timeline to return to work. My fiance and I both worked at OSF, and so we're both receiving the regular and federally boosted unemployment. Mine's just equal to what I was making, but I'm not getting any pension or 401k or health coverage or any of that. And hers is a bit more, but now she has to pay $400 a month in health insurance. And COBRA was way too much, so she had to lose dental and vision and all that. We're okay for a while. We had a rainy day fund, but that's for 3 to 6 months. And as you know, as you've heard from the other people here, Stephanie and Grant and Victoria, we need a bridge that goes a lot further, specifically tailored to live entertainment workers. And I thank you and your bipartisan co-signers for the bipartisan letters sent to Leader McConnell asking for some sort of, something that really speaks to what we're going through, because we're going to be the last ones to come back. It's not about, are we safe going to work? It's, are people, does the public feel safe enough gathering and paying the privilege to do so that we can go back to work and earn our living? So that's the thing I want to share. So our CARES extended regular employment is going to run out, at Christmas. We're going to lose our boosted unemployment next week, and we're going to be down to 40% of we're 40% short week by week. And we don't expect to work. I don't expect to return to work till summer or fall of next year. And I would gladly return to the worst 18-hour day in my memory. But until people feel comfortable, I'm not going to get a chance to do that. So please help me and Grant and Stephanie and Victoria and the millions of unemployed live entertainment workers we represent. We're going to need more unemployment weeks. We're going to need that federally boosted unemployment, a COBRA subsidy, and we need testing, tracing, and treatment. And I was talking before you got on the call about the Worker Relief and Security Act that Don Beyer out of Virginia wrote. And that's not perfect, but it's a tiered approach. And so thank you for your time.
Well, thank you. And having been a regular guest at Shakespeare, it has a special place. My wife and I are older parents, and we went with friends to a Shakespeare program a number of years ago. And our friends said, Nancy is pregnant, my wife, and they were the first to know that she was having twins, and it was all due to Shakespeare. So we're glad that you're on the call. Couple of things. I mean, we're going to push very hard for the extensions of these benefits. Mitch McConnell is going to push, as far as I can tell, to try to ratchet it down. I mean, he's talking about like well over a 50% cut in the supercharged benefit. God only knows what he's going to do, Michele, in terms of the extra weeks and all of that. Now, one point that hadn't been made, Gwen, that I spend a lot of time on, you know, my background's working with the elderly, the Gray Panthers is my background. I think one of the many aspects of the coronavirus that has shown the shortcomings in our economic system is how people like you are just getting clobbered on healthcare. You know, it used to be you'd have healthcare with your job, and I've been trying to say for years, it's been kind of a lonely outpost, that the system that was set up in the 1940s when you got a gold watch and you stayed put for 40 years until they took you to the, you know, big restaurant in town and gave you a gold watch and a steak dinner. That doesn't exist anymore. I signed on to, and I think a lot of people were surprised, I signed on to Bernie Sanders' bill on the Emergency Healthcare Guarantee Act, which said that for purposes of this pandemic, Medicare would pick up out-of-pocket expenses that people like you have. Now, do I think this is going to be a pretty heavy lift with Mitch McConnell? You know, obviously. Can we make COBRA more workable? That's why we have the incredible magic of Michele on this call. And Michele, what can we do in the short term with COBRA? Because people are telling me it's not covering very much and it's costing a lot. And I think it would really, apropos of Gwen's situation, I just, you know, ever since I was director of the Gray Panthers, I always thought healthcare was the most important thing. Because if you and your loved ones don't have your health, and everything else goes by the boards. So let's see if we can see if Michele's got a little magic up her sleeve on the COBRA situation that maybe even Mitch McConnell, who doesn't seem to care a whole lot about people who work for a living, that he might go along with. Michele, what are our prospects on that?
Well, you know, there was a full COBRA subsidy in the HEROES Act, and Congress did subsidize COBRA to some extent in the last recession. So I see that there's probably some room for some subsidy of COBRA going forward. I think that's a total possibility. And I would also point out, that there are triggers to additional weeks in Senator Wyden's legislation. So both of those things would be very helpful.
Great. We do have 10 folks with short stories to share. So I wonder if we could have all our storytellers share a story, and then Senator Wyden and Michele, so we don't run too far over the hour for you, if you wanted to kind of respond in aggregate, or if there's any particular one you wanted to call out. So next up we have Joy from Wheeling, Illinois.
Hi, thanks so much for letting me speak today. I'm from a northwest suburb of Chicago, Illinois. I really appreciate that you've already addressed the rhetoric, the hurtful rhetoric that we've been hearing about, that we just don't want to work. I haven't met anybody that doesn't want to work. I fall into two unique categories. I have an underlying health condition. I have a lung condition, and COVID-19 puts me at great risk. I have a very high risk of severe complications if I contract it. And while I've had a very successful career, I make a very, very nice living. In fact, the extra $600 is still less than half of what I was making. I am single. I am the sole support of my home, and now I haven't been able to work for 4 months. I love that you just touched on health insurance, because in Illinois, just my health insurance alone is $865 a month, and only one of my inhalers that I need each month, and I need more than one, is over $375 a month. So this does not even take into account the cost of keeping a roof over my head, utilities, food, and the basic cost of living. I am fortunate that I lived within my means. I have some savings, and I've been able to supplement those extra expenses because, like I said, I'm living on less than half of what I was making. But at 57 years old, I'm finding ageism. I'm trying to look for work that will keep me safe, that I can do with my lung condition, but it's much harder to find than it seems. I am a certified paralegal. I'm a certified mediator. I have a skill set that I should be able to get some work for. And in the meantime, if this isn't continued, if that extra supplement isn't continued, I won't be able to maintain my health insurance or keep a roof over my head. I really love that you're so in this. I can see that. My senators from Illinois, Senator Duckworth and Durbin, are in it too. And I just, what else can we do to help Mitch McConnell see that we really want to work and we also want to be safe? And thanks for letting me share.
Good.
Yeah, thank you, Joy. I hope some of Senator McConnell's colleagues are watching this and hearing you. So next up we have Crystal from Visalia, California.
Hi, everyone. Cristel Jensen. I live in the Central Valley of California. My community, all of them, the reason why, well, I represent the Central Valley Mutual Aid Network. And the reason why we formed is because after the pandemic started, the Central Valley of California represents a vast majority of immigrant communities. And we feed the entire state, and I want to say that we also feed the entire nation. And a lot of these families, I am really happy to hear that folks are getting the assistance. Those $600 are really helpful. But the communities that I work with, those who I am in community with, my friends, family members, they really don't get that privilege. They really need to get out there and work every single day, and they were completely left out from the relief package, meaning that they didn't get any stimulus checks, they don't qualify for unemployment, they don't get any $600, per month. And I know that the state of California made a huge effort to protect immigrants and provided some funding, which was reflected as a one-time payment for $500. But these families, they still need to pay rent, they still need to pay bills, and they still need to pay for education for their children. So as of right now, our immigrant communities and new immigrants who are arriving in California are completely left out and erased from any program available in the United States, and particularly in California. And then when we are presented with solutions like AB 1436, you have senators like Ana Caballero, who comes in with her own bill and denies, protection to some of the renters, 17 million renters here in California, because she's trying to push, her own bill. So really what I would love to see happening, as we have our senators, taking action and modeling radical leadership and really stepping into their power, expanding those benefits and expanding their visions so that immigrant communities are protected, so that our families, those who put food on your table, are protected. So those who get their groceries restocked and their vegetables fresh are protected. Because as of right now, they are not. And then you have you have cases like folks who still need to get out and work in the fields, and they're just given a permission slip stating that they are allowed to go and work, whereas, you know, respecting social distancing rules and being, you know, as cautious as possible, but ICE rates haven't stopped. So we have families who are really afraid of, you know, like getting out and work and providing for their families, and they don't have the great privilege of staying home because there's not benefits for them available. So really, it will be really, really awesome if we can start working together so that these families are protected and they receive the same benefits as any other citizen in this country, because that's part of their dignity and humanity, and it should be a right.
Good.
Thank
I'll
you,
have
Crystal.
comments, Crystal, at the end.
Thank you so much, Crystal. Next up, we have John from Troutdale, Oregon.
Hello. Thank you for having me on, first off. So my situation before the pandemic, I was working 2 jobs. So I had a full-time and a part-time job. I am the sole income for my family of 5. My wife was pregnant and recently had our 2-month-old. And so she right now, back then and right now, wasn't working. When the pandemic happened, my part-time job went to remote work, so I was able to work from home and do everything remotely. My full-time job became dangerous because of the coronavirus. The cases were adding up. I worked for Precision Cast Parts, which is a Fortune 500 company. I worked for the.
Oh well.
Yeah, I worked for the central hub for the Portland metro area, so all the parts would come in and be shipped from there. And so I have diabetes, along with my wife being in her late-term pregnancy. Due to my doctor's discretion, he advised me that I should go ahead and take time off of work to keep from, 1, getting sick, or 2, bringing the sickness back to my pregnant wife and my newborn. So I did take a leave of absence, and during my leave of absence, because of the coronavirus, they had to do a bunch of budget cuts, and my department was liquidated. My particular position was created specifically for me. I was the only one that held that position ever in the company. It was a brand new thing, brand new department. So I can't just go out if I wanted to, if it was safe. I can't just go out and apply for that position again because it doesn't exist anywhere else. So now I find myself in a position where, because of how unemployment, and trust me, unemployment has been a blessing, but because of how the unemployment works, my part-time job gets deducted from my unemployment. So the $600 a week is all that has been supplementing in order for me to be able to make what I was making before and continue to be able to support my family. And without that, I would be from the full-time job, and because of the deduction from my still ongoing part-time job, I would be making less than half what I was making from that full-time job. So that's a huge deduction for me, and a situation where I'm going to have to decide whether or not I want to, have lights on or, have heat or whatever else. So that's my situation. And in addition to that, with my loss of my full-time job, which was providing us with medical insurance, I lost my medical insurance. Thankfully, me and my family were able to get on Care Oregon, which is great. But recently, I have been diagnosed with a strangulated hernia, which needs surgery. Wow. But I was denied the surgery from Care Oregon because it just isn't covered. And so now I'm in a situation where I have a medical condition that it can cause, it can cause infection. I can end up in the hospital because that tissue ends up dying. I can't get that because I don't have medical insurance that will cover it. So it's just like, there's a lot. I mean, it's not just one situation or another. There's many different aspects, to us as citizens that are suffering, and so, yeah, that's basically my situation and my story.
John, it just sounds like every time you turn around, you've had the worst kind of luck, you know, losing the full-time job, picking up the hernia. If you will just get us a phone number and an email, we'll walk you through things, starting with the Care Oregon matter, which is something I've worked with a lot. And I see a lot of people in this kind of situation where, you know, you've got the deduction because you are working, you know, part-time. And what you really want to do is be liberated to get some training so you can get another good full-time job and not get penalized for it. So if we can just have a phone number and an email, we'll follow it up and try to walk things through the system for you.
Awesome. Thank you.
And yeah, and I'll pass along your contact info, John.
Thank you.
Thanks for sharing your story. Next up, we have Sherry from Kansas City, Missouri. Sherry, are you with us? Sherry, if you are speaking, you are muted. Okay. Sherry, we'll come back to you if you're available. But next up, I'm going to go to Lorraine in Pasadena, California.
Good afternoon. Thank you, Senator Wyden, for helping us with this issue. I have been a tourism and hospitality in an executive role for, you know, over 13 years. I work for a convention and visitors bureau doing destination marketing, you know, connecting with tourists, bringing them to the area, meetings and conventions, all of these functions, which, as you know, provide huge amount of revenue for our local governments, for state governments. I mean, as you know, California, the industry employs 1.2 million people. We've got a lot of people in the tourism and hospitality, and especially the entertainment industry, as you've heard, that, you know, the entertainment industry supports all of our efforts in tourism. You don't want to come to LA if you can't do anything that's entertainment related, right? But this has really been a rough road for us. Most of the people I know, or a good portion of them in the hospitality industry, are either furloughed, unemployed, or underemployed. And it has really been a very difficult time. And as Donalyn mentioned, even with the enhanced benefits, as a professional, as an executive, my income is less than half, a little more than less than half, than I was making. And I certainly don't expect unemployment to gap my full salary. But in California, if I do not have the federal enhancement, the California unemployment at its maximum pays just my rent. Well, actually, it's short by $175. It's really scary to me. That means I'll have a place to live, but I won't have food, utilities, anything else. You know, I'm concerned, like Joy said, I have an autoimmune condition. And I tried to do California Care, and they wouldn't take me. They said, oh, you got a pre-existing condition, but we'll give you coverage. We'll let you buy coverage, but your deductible is $6,000 a year. I was like, okay, I can't do that. So I am on COBRA at $1,255 a month, and I'm running through my savings. I can only pay COBRA for another 2 months, and then I'm done. So it has been so very challenging. You know, I'm applying for jobs. I have a background in commercial insurance and commercial real estate. I'm applying for jobs in every other industry. But at 57, like Joy, this is rough for me to like, okay, now I'm going to change industries. And some of the people that have called me back said, okay, well, we're going to put you in an entry-level position. And I'm like, well, I kind of can't do that. But I'm just hoping that if we can get this extension, even for a couple of months, I think that, you know, the entertainment industry will come back later. But I think if we have an opportunity to get people traveling again, and we're looking at, you know, the industry started opening up, and then You know, I'm in LA County. We're close to almost another shutdown. And so it's a very scary thing to do at this stage in the game. And it's so close to the deadline, which I think is what's really concerning everyone. It's like, what are we going to do next week? And, you know, I always tell people, I think I am very, very confident in the tourism and hospitality industry. I think we will recover. But I think it's going to take a couple of months. People are starting to fly a little more, and they are doing road trips, and, you know, because people have been in the house for months. So I feel that if it was just a little bit longer, there would be jobs available, particularly in the hospitality and tourism industry. And a lot of us, I want to work. If someone called me right now and said, hey, what are you doing tomorrow? I'm like, what time do you need me there? You know, so it really is so disgraceful, and it is so really disheartening for those of us. Looking for a job for me is almost like a full-time job all day. I'm looking at positions and sending my resume and on LinkedIn, on every doggone thing that you can get. But I think for a lot of us, we just feel like, you know, give the economy a chance to open properly and safely. And many of us, the stories that we're hearing we work in industries where it isn't safe. So that's, you know, where we kind of all are. And it's really very scary. And I don't know what's going to happen. I think, you know, if we end up with more homelessness in California, especially in Southern California, I just don't know what's going to happen. I'm hearing also that the eviction protection plan that we have is nearing an end to end concurrent with the expanded unemployment benefits. That's going to be really, really hard. So that's my story. I'm sticking with it. You know, but I urge everyone to really, you know, reach out to your local, you know, senators and governors as well. That's really the best way to get the message out. But Senator Wyden, we thank you for just really fighting for all of us and really understanding what we're all going through, because it seems that the other side is just like, nope, nope, nope. So it's really difficult. So thank you for listening.
Well, Lorraine, thank you for laying that out. And I'm not going to use your name, but I'm going to mention to my colleagues next week that one person who was out of work told me in the last couple of days, if I got an offer from somebody, I'll be there tomorrow morning, because that kind of sums up what I'm hearing. Couple of points. I think you heard that we're going to be pushing hard for entertainment, hospitality, travel, because it really is a kind of chicken and egg sort of situation. You got to have the PPE and all the kind of healthcare services in order to get the industry back. And, you know, the industry is kind of waiting and saying, well, I don't know, should we make an investment in order to come back? So it's very much chicken and egg. There are a couple of things, though, that I'd like to get at. Michele, Lorraine was talking about her medicine being $6,000, and it sounded to me like she was being discriminated against for having a pre-existing condition. Is that right? I mean, Lorraine. Senator,
excuse me. It was the covered California insurance that I couldn't take. They told me I had a pre-existing condition. I could sign up for it for $755 a month, but the deductible would be $6,000 per year. So I opted to keep my COBRA.
Yeah, keep with me on this so I can sort it out. Is Cover California their version of Medicaid, Michele?
I think it is. I don't know that much about California programs.
Yeah, it's part of the Obamacare.
But that doesn't sound fair or right. So if we can have a phone number, we'll since you're in California, we'll work with Senator Harris and Senator Feinstein and follow up on that, because as soon as you talked about $6,000 for just one medicine, I'm going to talk about medicine later. Joy mentioned it too. we'll follow up on that. But we're going to push hard, A, for the extension, and B, for extra help for entertainment and hospitality and travel as well.
Thank you.
Thanks, Lorraine. Next up, we have Justin from Portland, Oregon.
Hi there, Senator. Can you guys hear me okay?
We can hear you fine.
Thank you so much for taking this time. I'll try to keep this brief. I moved to Portland in 2011. I'm a sound engineer. I tour with bands live for a living. I've done so for the last 12 years. In February, I was coming out of our industry's downtime, which is the 4 months surrounding winter. And I was lucky enough to find a 4-week tour last minute. And I got a phone call from a friend and they said, hey, can you get on a plane in a day? And I made basically that happen. I was on one of the hardest tours of my career for 4 weeks. And I got done with that tour to on March 6th, 4th to the whole industry basically just caving in the next couple weeks. I had 10 days of local work scheduled, and those just systematically died off at this one small venue that I normally only work 4 days a week at. Anyhow, so for income this year, so far, I've only gotten that 4 weeks of work. We're now entering August, and I've worked 4 weeks this year because our industry just doesn't exist right now. We got Live Nation got together and started a fund and gave a lot of people in our industry a $1,000 stimulus check, which I received and was grateful for that. That really helped. I also drained an IRA that I had that had $3,500 in it. I ended up getting about $2,800 of that, but I needed all that money. Most of my income comes from 1099. That job that laid me off in March, that's maybe 10%, 5% of my income, and I was W-2 through them. So they laid me off in March and I applied. I'll just give you maybe the unemployment story of the saga of trying to receive any benefits. I'm also an S Corp. In addition to that W-2 employment, I get 1099s, but through my own S Corp. So companies that like bands, they pay me, pay the company pays me. I applied for EIDL and PPP and was denied for PPP and EIDL. I couldn't get anybody on the phone at SBA to explain the forgiveness of it. And I couldn't prove my payroll somehow to SBA for the PPP. So I got denied last week for that. I wrote some of this stuff down. Basically when the first unemployment application was submitted was in March. I never heard anything back from that. Finally in April, when the PUA got announced, I applied the day that came out and heard nothing about that. There's no status update or anything in Oregon about what happens when you submit your paperwork, if you did it right, if it was accepted or not. After a few weeks, I just started calling. I just made it my job to start calling. I would call 500 times a day to get busy signals all day. And after about 2 months, I finally got through to somebody who talked to a couple of her associates. And after a 10 or 12-minute phone conversation, she said, it looks like you just got to submit a couple of more weeks that you missed, and we'll review it tomorrow, and next week you'll see benefits. And sure enough, on Wednesday and Thursday, I received 12 weeks of PUA and 10 weeks of the regular unemployment and 12 weeks of I received slightly less of the $500, basically by 2 weeks. So I got them all in one day, and then I got the next week's payment the day after, and then payments stopped. So I'm not exactly sure what they did to actually get those payments in, but for the last month, I haven't received any. So I'm so grateful to have gotten any of that money after all of those phone calls and everything. That money came in, and that has been helping sustain me. But we've heard so many other people say at this time that our industry is not coming back right now. Closing down the $600 in a couple of days, I can see that you guys are making efforts to continue that, but it's just, our industry was the first to close. It'll be the last to open. If, say, in 3 months, we come up with a cure for Corona and they say we can do shows again, in 3 months, we'll be entering into the downtime of our industry. And then it's 4 months after that that we might even have a chance to find a band who's going on tour to get a job. And that's if shows even happen. So if we were able to figure out in 3 months a cure, I still won't work for 7 months from now. And my benefits run out in 3 days. I have about $5,000 left in my bank account. I have some more investments accounts that I could probably empty. And I've got credit cards at this point and no job ever to return to. I've thought about diversifying and going into other aspects of sound engineering or sound design. I'm 41 years old, and in 10 years, I might be where I am today in my career, in another career. I'll be 51 at that time and having just started over again. Like, it's not just me, I know, and it's tens of thousands of people who work in my industry, in not just sound engineers or crew people, but everyone who works at the venues and the production companies and the insurance companies. That it's so many people beyond just people who do my job. And it's just tens of thousands of people who do my job worldwide who are supposed to now suddenly find other work. I found someone, and this is the last thing, I'll try to keep this brief, but the last thing, I found a website, and maybe some other people have seen this, that are like, it's other jobs you could do in this time. And the second job listing that was comically on there was sound engineer, broadcasting technician. I'm like, I'll take that job. Give me the application and I'll go take that job. I mean, if someone called me tomorrow and said, let's do a show tomorrow, I'll give you X number of dollars to do it. Like, yes, I mixed a song for a band that I like just to do it. They didn't pay me anything. I just miss mixing. It's been five months since February since I've mixed.
Justin, let me interrupt this, because I always like to make sure with Oregon folks, we're being as constructive as you can. You get 2 senators and you got to stand up for you. If you were in my shoes, what would be helpful to you and people in the music venues and kind of related jobs? What would you be working on? You've heard me talk about training. You've heard me talking about standing up for hospitality and music and the like. If you were in my shoes, what would you be working on?
Justin, you're muted right now.
Are you there? Okay, sorry about that.
Perfect.
What others have said earlier about there are no guidelines for how things should reopen. I think all these venues and everybody wants to comply, but no one's been given any sort of guidelines. So if there was just, everyone needs to get scanned as they come in, there's this, and we can do shows, I think then people would be like making steps towards making those things possible. And in the meantime, what Gwen said earlier is perfect. Like what Lorraine said, we need time. I mean, like, there's no cure and there's no testing, rapid testing. I mean, even rapid testing, wouldn't that be if everyone came in, get a 10-second test? I saw there was in another country, where was it, in Israel or something? There was a 10-second breathalyzer style test. If everyone came in, got that test every morning, we could do a show because no one has the virus. It's like, we could open like that if we just had a way of knowing who was infected. But in the meantime, while there's no solution in place, we don't have income. And I want to go back to work. I want to do shows. I've worked for the last 12 years to build a career that I love, that I think I'm good at, and it adds value to people's lives. At least that's what I tell myself when I go to work. And so I want to do it, and I think a lot of other people want to do it, but nobody knows how to do it. And how can we move forward without knowing how?
Justin, the one thing I can add from what we've talked about is we are going to bring these Trump folks and the McConnell folks kicking and screaming and hollering into doing more testing. We need more testing. We need more PPE. We've seen the coronavirus spikes, around the country. And I mean, that directly relates to the uncertainty that you're facing. I mean, there you are sitting there. Hey, if they got a vaccine now, I could work in 7 months. Well, a big part of this is if you had, testing, then you really could be in a position to work safely. And the Trump people have walked away from testing. The president actually, for a while, really seemed to be discouraging people from testing because he thought his numbers, looked less positive, which was, an outrageous kind of statement. And last weekend I was home and I was working with small companies making PPEs. So in addition to what we were talking about in terms of the extension of the supercharged benefits and the support for hospitality and the support for training, we're going to be pushing hard in the coronavirus package for extra help for folks on testing and training. And I think your industry, and since a couple of people mentioned it, and because we knew that we'd been supportive of the industry, there is a piece of legislation I'm a co-sponsor of called Save Our Stages, and I'm a co-sponsor of that as well. And that's the program to help the live venues. So we're going to try hard to get that into coronavirus and I think, Sarah, that may have gotten some support in the Pelosi package too, didn't it? Yeah, Heroes, House Heroes, so to speak, the House version did have some support, for that. So.
For what it's worth, the only other thing I wanted to mention is at this point, the option to call unemployment and try to sort this out is unavailable because at this time you just get all circuits are busy. You don't even get busy signals anymore. So.
Well, you may know, Justin, that and I never did this in my time in public service. I insisted that the governor replace the head of the Oregon Employment Division because I was just convinced that to not give you a status report was just outrageous. Because I mean, it's one thing, you got to get all the records and all the material, and the state's Oregon, Michele, has a particularly outdated system. I wasn't very long ago, they were using COBOL programming. And I said, I can't believe that we're using technology about as old as I am. And so I hope that it's going to pick up now in terms of status reports and the like, Justin. And if you'd like my staff to call, we'll be able, I think, to get through and find out kind of what your situation is if you'd like us to do that.
I mean, I would appreciate that, but I hate to divert attention from some of the people that I've heard who are in far greater dire situations than I am. I mean, I'd be grateful for any help I can receive, but it's not just me.
You make me proud. The Oregon way. You'll wait and help other people too. It's not mutually exclusive. We can help lots of people.
I would be grateful, and having this forum has been invaluable. Thank you, Nathan, and everybody.
Get us a phone number and an email. And I like to say to everybody, my goal is always to under-promise and over-deliver.
And to editorialize a little bit, there's certain things that Senator Wyden is able to do for Oregonians, through constituent services. Don't underestimate those asks you can make of your representatives for folks in other states. You may not get the same kind of answer or the same kind of care from their staff, but do try to call your House member, try to call your senators, because that's what they should be doing. That is part of their job. It's not just to vote on things in Congress, but to listen to you and to represent you and to try to help you navigate government services when they are difficult or complicated. So going on to our next storyteller, Louise in New Orleans. Ms. Louise?
I'm here.
Great.
Hi, y'all doing? My name is Louise Francis, Louise W. Francis. I'm with Step Up Louisiana. That's who I'm with. That's how I got on to the call. Ben told Nate about me with my story. I've been on TV explaining my situation and everything what's going on. I work at the Sheraton New Orleans. I've been there 20 years. I work in banquets and also hospitality too. It's so many people around the United States working in hospitality. The stories you hear about hospitality. I was one of them. I was furloughed once Corona hit. I was furloughed. I go to work at 3:45 in the morning. I work in banquets. I do all the cooking for all the banquets, all the function from breakfast, lunch, reception, and dinner and all that. I get it started. I'm the one open up. I was like a manager, a number one manager in the kitchen. And also when Corona when it started, we got furloughed. I said, well, that go our job right there, you know. And like I said, I love working. And like everybody said, but my situation was, you know, they just took our livelihood away from us. We did not ask for this. And when they go around saying, oh, they just want the unemployment because they don't want to work. No, I love working. I love working. Every time they walk in that banquet kitchen, I have a smile on my face because I love what I do. Just like a lot of the blue collar American workers, we love what we do. But they took our livelihood away from us. And once they did that, now they're trying to take the $600 away from us. We didn't ask for this. Like I said, I think the official and everybody need to get it together because like me, myself, working at the Sheraton Hotel 20 years, I love my job. I'm going to do what I have to do. But right now I have to pay for my own insurance because I know I'm not going back to work right now because I work in F&B. F&B is not coming back right now, and I know that. I come from a 1,100 room hotel. If it come back, they're gonna downsize it to a 200 room hotel. They're not gonna say, Miss Louise, you want to go work in room service? You want to go work in housekeeping? No, they're gonna take the people who've been there long enough. So what I have to do, I have to find me another career. So what I'm planning on doing, I love cooking because I've been cooking for 40 years. And also, I'm 59 years old. I made 59 July the 7th, but the Lord give me strength every morning at 3:45, leave out my house and go to work. And I work from 3:45 to 7 o'clock in the evening. I work a lot of overtime. So when they always say, y'all just want that money, no. That money due to us. That's our money we got in there. And they just be assaulting us because I love my job. And Senator White, I thank you for letting me get my story out, and Michelle. But only that I want to say, we done went to Baton Rouge in front of the other consulate and talk about this. We did like a Caribbean, all different community, nonprofit. It was Step Up Louisiana. It was Moving On. It was national. We all got together and did a Caribbean. And went around to Kennedy Center. We rolled around the federal building. Then they went to Metairie and gave them the petition. I'm fighting for everybody in New Orleans, everybody. So if you please, I have faith something gonna happen because it's too many of us. Too many.
Thank you, Louise. I didn't mean to cut you off. I'm sorry.
That's okay. Thank you. Because I have another meeting I got to get with Step Up Louise. But that's okay. I love this.
Louise, can I just ask a quick question? I gather from your comments, and they were very articulate, and I appreciate it. The two things that would help the most would be support for the hospitality industry, because that's been big in New Orleans, and that would really be helpful. And then the extension of the unemployment until your industry comes back, the extra $600. Are those the two biggest things?
Yes, going on right now because there's so many people in hospitality down here in New Orleans, like the Sheraton Hotel, the Mount Leon. It's so many of them, so many. And right now, I look at it, it's not coming back. And right now, what it is, like different little restaurants and stuff is open up. But by Corona is going back high, they can really shut a lot of it back down. You can't work. You can't.
Yeah. Sarah, sitting here with me, went to Tulane University, so she's been telling me about New Orleans.
Okay.
Thank you.
Thank you so much, Louise. We have one more story with us. I know we're running well over the time. I appreciate everyone who is watching on Facebook Live, everyone who has been in the Zoom the whole time. I've really been moved by every single person's story, and I'm sure our panelists have as well. So our final storyteller is Sandy from Whittier, California.
Yes, hi. Sorry about that. I was on mute. Well, my story is I'm not in the entertainment industry like so many of you are, but I am a Lyft driver, and I face the same difficulties about going back to work because, you know, I'm in such an enclosed space with so many people, you know, picking them up, dropping off, picking up, dropping them off. And I am high risk. I'm an older, you know, I'm older and I have issues with bronchitis, things like that. My daughter's high risk. For me to go back to work would just, it would put me at risk. You know, being in California where our numbers, I mean, now we surpassed New York for the highest numbers. And that's just, we're the number one in the nation as far as COVID cases. And it scares the living crap out of me that I can be infected. I don't know what history these passengers that I'm picking up have. You know, did they go out to party last weekend? Were they exposed? Were they, you know, did they test positive and know it but don't care and ask for, you know, and still going about their lives, which I know people are doing. So it's you know, scary for me, and I'm sure a lot of Lyft, Uber drivers are in the same boat, you know, with it being in such a closed, confined space, and you know, finding, you know, disinfectant spray to even you know, just simply clean my car in between, you know, passengers is just something that is you know, I can't even do that, you know, because finding any kind of disinfectant spray is nearly impossible because it's always off the shelves or sold out, or, you know, so it just makes it incredibly difficult to even think about going back. And, you know, and trust me, this is a job that I love. It's a job that I get to choose my hours. I get to, you know, I don't have bosses breathing down my neck. I literally just drive. It's a very easy job, and it's something that I love, and meeting people and talking to people. And, you know, I've been in customer service for years, and I enjoy, you know, learning about people and talking to them. And so it's, you know, a job I definitely want to get back into, you know, when I feel safe enough to do it. And right now I don't feel safe. And if I were to get infected and bring it back to my daughter who has asthma and she gets infected and sick, you know, I couldn't forgive myself. And I think a lot of people just, yeah, I think it's just, you know, I hate to say it, but I think the government just looks at everybody's case like it's like a one size fits all, you know, and it's not, where there's so many different, you know, aspects, so many different stories, you know, and you know, I think it just has to be looked, you know, at that, you know, I mean, I'm hearing the stories that you're all sharing about the entertainment industry, and you guys are right. There's no returning anytime soon. Like I can, you know, possibly return in a couple of months when the numbers start going down. That's fine, but the entertainment business, it's not looking like it's going to open anytime soon, because we're going to be limiting, you know, large crowds, and even if we do open up, the crowds are only going to be, you know, maybe at 20% capacity, 30%. It's not going to be full capacity until a good, you know, at least 6-8 months, maybe even a year, you know. So there's so many different stories that I think, you know, the Senate, the Congress, the president, they have to look at and realize that it's just not you know, everybody's not the same. They're looking at statistics, which is fine, you know, but they got to look at the human, you know, the people, you know, and have a little more empathy and more understanding that you know, we're all in this together and we're all hurting, you know. So I don't know.
Sandy, two quick points, and then I want to let Michele have a chance to have the last word, and I got a couple additional points I'll make real quickly. Listening to you, I come back to testing. Without the testing, everything else, you know, falls apart. And you as a mom who's worried about your daughter, you should not have to go home at night just living in fear. So that's number one. Number two, I did introduce legislation a couple of days ago because the labor secretary, I mentioned this, been dragging his feet, making it clear that you don't have to go back to work and give up your benefits if you'd be in an unsafe situation because of your pre-existing conditions. And Michele, I am pretty sure you helped us with that bill. So that's legislation that would be of help to you. So let's let Michele make any comments, because she is our rock star in terms of really addressing these technical issues. And I'm going to make a couple of comments on several of the statements that I haven't touched on, but I think are so important. Michele?
Yes, thank you. So first of all, I just want to say, you know, thank you for all your stories, for all your passion, and your work on this. I think one thing I noticed at the beginning of the pandemic was I was getting a lot of questions about, why am I not getting my benefit? Why is this not working for me? And I think that what people are starting to figure out is we should be asking, why are we not getting what we need? Why is this not working for us the way that we want it to work? And when we start thinking like that, then we have power. Then we can fix things. And I think that the kind of thing that you're doing, and Nathan pulling together these town halls, is just, it's a hugely helpful way to make sure that we're acting collectively. We're in this together. Even if you're not getting the $600, the $600 is affecting your life. It's keeping the economy from crashing. So I think thinking about that is really important. And I just wanted to go back to the question that Christelle raised about undocumented folks. And I do think that figuring out how to cover undocumented folks going forward is really important, because, you know, it's incredibly unfair that we have all these people participating in the economy and working very hard, and then, you know, really forced to take unsuitable work. I really think that that's something that we need to address going forward. So to all of you, if you had an outstanding question, please do feel free to talk to me, particularly the gentleman from Utah who had the documentation question. It seems to me like something that could be fixable, but I just want to get more clarity on that. And you know, thanks again, everybody, for participating and sharing your stories and asking your questions.
2 points. Apropos, Crystal, of what my colleague Michele said, I think it has been so unfair that the 4 coronavirus packages have completely failed immigrant communities, because we're in this together. And I tell everybody, when I have my Nathan in-person town meetings in Oregon, unless you're a Native American, odds are overwhelmingly that you're part of the immigrant experience. I know I am. My parents fled the Nazis in the 30s and not all got out. So here's what's going on. One, a group of us introduced the Coronavirus Immigrant Families Protection Act. And that would allow for coverage for emergency Medicaid services, also for testing, and that would be available regardless of immigration status. And we also rein in ICE in terms of going after members of the community and say it's not an enforcement priority. We also say that mixed status families should get the stimulus payments for U.S. citizen children to help provide for the kids. So there are a group of us that are working really hard for that. We can get you a copy of it. It's called the Coronavirus Immigrant Families Protection Act. It's backed by many immigrant advocates, and I think it's shameful that the last 4 packages just failed to serve immigrant communities. Joy, 1 point for you. We actually had a bipartisan prescription drug, bill to rein in the costs of medicine and ensure that the costs wouldn't be more than inflation or they'd lose their subsidies. And the problem was Mitch McConnell is just completely tied to the pharma people. And so then it just became a political hot potato, and the Republicans just wanted to put their name on it so that they could tell everybody they were for lowering medicine costs. And that was sort of that. But let's just put it this way. Things may change in 2021. And if I have anything to say about it, Joy, in early 2021, we're going to lift the restriction on Medicare so Medicare can bargain to hold down the cost of medicine. And we're going to take away the subsidies from the drug companies if they keep ripping you off with those high prices. So wonderful, wonderful meeting. We went almost 2 hours, and I don't think a minute of it was frittered away because all of it was really important to the Oregonians. Thank you all for turning out. The Oregon Way is alive and well and gave me a lot to follow up on. And especially to Michele and Nathan. I think I can speak for all of us. We're running with the right crowd when we've got Michele and Nathan on the case. And let's just put this discussion into these issues are not, this is not the end of the discussion. This is to be continued, and I hope some of you will want to do that in the future as well. Okay?
Thank you, Senator.
Thanks, everybody.
Thank you, everybody.
Michele.
Take care
All
tonight.
right.
Bye-bye.
Thank you.